The vessels of the head and neck is a favorite MCQ in the exam. Mainly the challenge is, which vessel is a branch of which vessel? What is circle of Willis? Then some vessels have right side different origin, left side different origin, same vessel code. So these are the important issues. So let us take up subclavian artery. Subclavian artery, if you take on the right side, this is right subclavian. From where is it coming, doctor? The right common carotid and right subclavian together are coming from common one, which is brachiocephalic. Whereas directly from the arch of aorta it will be arising on the left side. Then when the subclavian artery got originated, the anterior scalene muscle, you have anterior and posterior scalene muscles. Anterior scalene muscle will be dividing it into three parts. From the origin until the medial border of anterior scalene, underneath the anterior scalene, and from the lateral border of the anterior scalene until it become axillary. Now why we need to remember all these things? Because which vessel arises from subclavian is not sufficient for examiner. Which part of the subclavian is the headache, which you need to remember. Now doctor, what are the branches of subclavian? Very, very important branch is vertebral. Vertebral artery. From the first part of the subclavian it will be arising. First let us review everything about vertebral. How does it basically pass, doctor? The transverse foramina of the C1 to C6, not C7. So examiner favorite question is either C1 to C6 or C2 to C7 or C1 to C7. So what is your answer? C1 to C6. And ultimately vertebral will be passing through the foramen magnum and enters into the cranial cavity. So vertebral is arising from first part. One more vessel which arises is basically called, you are able to see, doctor, this thyrocervical trunk. Thyrocervical trunk. So thyrocervical trunk is a short trunk which also arises from the first part of the subclavian. Now, what are the branches of this thyrocervical? A very, very important vessel is inferior thyroid artery. Chalo, what is the challenge in this? Inferior thyroid artery comes from thyrocervical but not superior thyroid artery. From where will superior thyroid artery comes from? Arey, superb. I am thinking you're all stalwarts from Usmania Medical College, means the cream of Andhra Pradesh in the MBBS entrance will enter into Usmania, right? So I am happy to know that. So inferior and superior thyroid artery are different. So inferior thyroid artery, and in turn inferior thyroid artery will be giving rise to ascending cervical artery. And why we need to remember is ascending cervical artery is in a very close relationship with phrenic nerve. And inferior thyroid artery is in a very close relationship with recurrent laryngeal nerve. That's the reason we need to remember. Then transverse cervical artery is another important branch which will be coming from the thyrocervical trunk, followed by suprascapular artery. You need not remember them. They will never ask about them in the exam. Only they will ask is inferior thyroid artery is a branch of which vessel. You have to be 100% sure. Now doctor. Then after thyrocervical is over, vertebral is over, internal thoracic artery is the third branch which is coming once more only from first branch of first part of the subclavian, and will be descending down behind the upper six costal cartilages, and ultimately it will be breaking down into epigastric and musculophrenic. This we will never forget, because in the thorax dissection the moment you will be anxiously waiting how the heart looks. in the anatomy dissection of thorax. So all your eagerness is take a knife and cut the ribs and open the sternum, and whoever opens is will give the party, cadaver party. So when you open, what is the first thing? Very close to the ribs, medial aspect of the ribs, internal thoracic artery is what you see. Now, second part of the subclavian ka khata shuru hota. So what are the branches? It gives rise to costocervical. So thyrocervical trunk comes from first part, costocervical comes from second part. But from which aspect of the subclavian it comes from? From the posterior aspect of it, it will be basically coming from. Then what are the branches it will be giving rise to? One deep cervical artery, superior intercostal artery, and it gives rise to the first two posterior intercostal arteries. So these are the branches of costocervical trunk. Then third part of the subclavian, say only one branch will come. That is the dorsal descending scapular artery, which is the one which is important for the anastomosis of the vessels in the scapular area. That's the only reason we need to remember. But otherwise, that's the only branch coming from the third part. Now, doctor, what is the surgical anatomy about subclavian artery? Two things we need to remember. Subclavian artery can be involved in the neurovascular compression in a thoracic outlet syndrome. What is the cause of thoracic outlet syndrome? Any bronchogenic carcinoma or any lymphoma, any anteromediastinal mass can lead to the compression and prevent the jugular veins from draining, right? And there will be puffiness of face with dyspnea. So one of the neurovascular bundles which can get affected is subclavian compression can occur in thoracic outlet syndrome. So what is the main reason subclavian can get compressed otherwise? One more reason. Cervical rib also can lead to the compression of the subclavian. Subclavian ultimately will be becoming axillary and supply the upper limb. So cervical artery, if it is cervical rib, if it is compressing, what will it lead to? Weak pulsations of the ulnar and radial arteries is what you basically come across. Very interesting is subclavian steel syndrome is what you need to understand. Basically, vertebral artery is there, no? It is arising from subclavian. Subclavian ultimately is becoming axillary artery. काम करने के लिए हाथ से काम होता. So hand should get some energy, some blood flow. But हाथ को काम करने के लिए बोलने वाले कौन होता? Brain. That receives the blood from vertebral artery, right? So if there is any occlusion of the subclavian artery proximal to the origin of the vertebral artery, right? Then what will happen? Vertebral, see here there is an occlusion proximal to the origin of the vertebral artery. So the subclavian is expected to continue further and become the axillary, right? So when the hand is not receiving the blood, what it will do? It will suck the blood from vertebral in a reverse direction. Now you may ask me a question. Sir, vertebral artery also is coming from receiving blood from subclavian only, no? If the blood doesn't go to the axillary, how is blood is there in the vertebral is a question, right? But vertebral will have combined to form basilar. So that is the reason the other side also it has got a chance of sucking the blood, and that blood is being sucked and served to the hand. So whenever the patient is working with the hand, he gets syncopal attack, because through the vertebral artery all the blood is being sucked and then sent to hand, then the brain stops working. Right? That is the subclavian steal syndrome. What is the important issue in this? What is the common MCQ in the exam? Subclavian steal syndrome occur because the occlusion of the subclavian proximal or distal to the vertebral. So कभी भी आप जिंदगी में नहीं पढ़ के एग्जाम को गए तो डिस्टल बोल के आंसर करते. So if you know the logic, there is no strain in the exam. You need not strangulate your neck and think about it and answer. If you know the logic, right? It is proximal to the origin of the subclavian. I mean, to the of the vertebral is what need to be remembered. Vertebral's origin from the subclavian. So you can see when a dye is being passed, how it is passing? It is passing into the other vertebral, and through this vertebral, it is passing into the arm, into the subclavian. So that is how that reversal of the direction of the blood flow can be demonstrated. Now, doctor, common carotid artery. Are we going very slow? It's tolerable speed, right? We already know, sir, where is inferior third. Jara jaldi bhagao, sir. Why are we going so slowly? Oh, notes हमको छोड़ दिए तो हम समझ सकते. Yeah, आप समझ सकते. But there are a lot of our other compatriot players who want the things to go a little slowly. Anyway, common carotid. Right comes from where? Left comes from where? Right comes from the bifurcation of the brachiocephalic, but the left directly comes from the aortic arch. And both of them will ascend in the carotid sheath basically. Common MCQ in the exam is external and internal carotid it will break, no? Common carotid. At what level will that bifurcation occur? What is the surface marking? It is typically at the upper border of the thyroid cartilage. Adam's apple is the place where that bifurcation typically happens, is what need to be remembered. Now, a few comments about what is a carotid body, what is a carotid sinus. Let us be very, very sure. At the bifurcation of this common carotid, we have a ovoid body which is called carotid body. It is a chemoreceptor. It controls respiration. And any chemical changes in the blood, hypoxia, hypercarbia, acidosis, can all be perceived by this carotid body, which is a chemosensor fundamentally. It is not a baroreceptor, be very sure. And what is the afferent and efferent to this carotid reflex is one of the common questions in the exam. So there is a nerve to the carotid body which arises from the pharyngeal branch of the vagus, and also it is innervated by carotid sinus branch of the glossopharyngeal. Both glosso and vagus basically supply, but commonly examiner will ask, what is the carotid sinus nerve? What is the nerve to carotid body? They are different. Nerve to carotid body is the name given for the branch of the vagus, and carotid sinus branch is the name given for the glossopharyngeal. Then what is carotid sinus? Typically it is located at the origin of the internal carotid from the common carotid. It is a baroreceptor which can detect the blood pressure, and whenever it gets stimulated, then it will lead to vagus to get stimulated, and that will lead to bradycardia, vasodilatation, and fall of the BP. So mainly it is innervated by the carotid sinus branch of the glossopharyngeal and also by the nerve to carotid body, which is basically vagus. And some people will have hypersensitivity to the carotid sinus. I still remember Colonel Bhagwan was our patient. So on the 50th, what is that called? Golden Jubilee. 50th wedding anniversary, the retired Colonel, his wife cheekily has made his tie slightly what you call brimmed well before going to party. He had collapsed and was brought. So she was all feeling guilt. Pura 50 years I loved him, how can I kill with my own hands? So but nothing happened to Colonel. So we made him to once more wake up and then participate, and uh, uh, continue to shower the same benevolence he shared with his spouse. Now, internal carotid. It has no branches in the neck, and it ascends in the carotid sheath along with the vagus and internal jugular, and it enters the carotid canal in the petrous part of the temporal bone. And typically carotid, when it is passing, has got a relationship with the tympanic cavity. You still remember the first class in ENT, anatomy we had, no? So it is separated from the tympanic cavity by a thin bony structure, and it is in relationship with cavernous sinus. It lies within the cavernous sinus, and in fact it will give small twigs to the wall of the cavernous sinus and hypophysis, pituitary, and also to the semilunar ganglion of the trigeminal, Gesserian ganglion. So all of them, it gives some amount of blood flow. So that's what carotid, internal carotid will be doing. Ultimately, it will be piercing the roof of the cavernous, and it makes an entry between the both clinoid processes. Where are the clinoid processes? You remember the sella turcica. So posterior aspect of that, you have clinoid process. Between that, it will emerge, and it forms a carotid siphon before entering into the cranial cavity. After entering, it makes a sinus, carotid siphon, and enters into cranial cavity. So after entering, it forms the various branches. What are the branches of the internal carotid, doctor? Ophthalmic artery, posterior communicating artery, anterocoroidal artery, anterocerebral, middle cerebral. They are all the branches. Posterior cerebral is a branch of basilar artery, which is formed by the fusion of the two vertebral arteries. Vertebral artery comes from first part of the subclavian. Subclavian comes from, depends on whether it is right or left. Chalo. Now let us talk ophthalmic artery. Ophthalmic artery, it enters the orbit via this optic canal with the optic nerve. Then what is posterior communicating artery? Posterior communicating artery arise from the siphon. Carotid siphon is there, no? From that it will arise, and it basically supplies the optic chiasma, optic tract, and hypothalamus. Then anterior choroidal artery. What does it basically supply? It supplies the choroid plexus of the lateral ventricles, which is the source for the formation of CSF. And it also supplies optic tract and radiation and lateral geniculate body, everything with vision. Carotids are closely related. Then anterocerebral artery, you all know very well. Anterocerebral artery is the one which will ultimately supply frontal and parietal lobes of the brain. And middle cerebral artery is also the branch of the internal carotid. Right, doc? Common MCQ asked in the entrance is, anterocoroidal artery is a branch of which vessel? You should be in a position to say it is the branch of internal carotid. Now, external carotid. From the upper border of the thyroid cartilage where there is a bifurcation until the neck of the mandible, you have this external carotid. Ultimately, external carotid, jaake, what are the terminal branches? Maxillary and superficial temporal artery are the two branches, terminal branches. Totally, there are 8 branches for the external carotid. So, what are they, doctor? Let us quickly see. Superficial, temporal, and maxillary are the terminal branches. Then, posterior auricular, occipital, facial, lingual, ascending pharyngeal, superior thyroid. They are all the various branches of the external carotid. So, lingual artery need to be remembered for one important landmark. What is that? Greater horn of the hyoid level may you have the lingual artery is what need to be remembered. Then maxillary artery is a different topic itself. There, what are the branches of the maxillary artery, etc., and it has got 1, 2, 3 different parts. Then superficial temporal artery need to be remembered because it ultimately gives rise to the transverse facial artery. So that's all the story about external carotid. the 8 branches of it and terminal branches. Then vertebral artery, doctor. Let's take in a little more detail about the vertebro-basilar system and the circle of Willis to say that we are fully ready with the vessels of the head and neck, right? So vertebral artery, it is a branch of first part of the subclavian. It passes to C1 to C6, transverse foramina, it enters through foramen magnum, and 2 vertebrals combine to form the basilar artery. And what are the branches of the vertebral before it combines to form basilar? Anterospinal artery, posterior-spinal artery, and posterior-inferior cerebellar artery. They are all the branches of the vertebral artery directly. So this is one thing you can't afford to miss, doctor. See, these are the vertebrals. So what is arising from them? Posterior-inferior cerebellar artery, anterior spinal artery, and posterior spinal artery. They are the branches of the vertebral artery. Why? What is the challenge which is involved in this whole process? There is one posterior inferior cerebellar, pica, which is responsible for lateral medullary syndrome of Wellenberg. You have ICA. ICA is a direct branch of the basilar artery. Then you have SICA, superior cerebellar artery, right? But these 3 have 3 different origins. So 3 sisters, 3 husbands. You must know each of their numbers, and if you miss one for the other, there will be huge problems. Now let us look into what are the branches of the vertebral: anterospinal, posterior-spinal, pica. You should not forget. Then basilar artery. Basilar artery is very, very important because if brainstem is standing like a pillar, like a floral tree, the basilar artery supplies the entire what? Midbrain, pons, and the medulla. So it is the vascular bone, vascular backbone of the brainstem. So it typically ends near the upper border of the pons. Which one? Basilar artery. After 2 vertebrals combine, that forms basilar. By the time it reaches the upper part of the pons, it divides into right and left posterior cerebral arteries. So what are the various branches? Within the brainstem also, forget about midbrain and medulla, because medulla ki lateral medullary part is supplied by pica. Pica is a branch of vertebral, right? So more important in the brainstem is the pons is all dependent on basilar artery. And why we are dependent on pons? Because the pons is the center for all our differentiation. Differentiation. If you plan to slap somebody, pons must tell that. If somebody slaps and you are feeling pain, who is telling that? Thalamus. All sensory need to pass through thalamus. All motor should go out through pons. That is a rule of neuroanatomy. Okay, doc? So, what are the branches of basilar artery? Pontine arteries, labyrinthine artery, and what will labyrinthine artery will be doing? Labyrinthine will enter through the internal auditory meatus and supply the cochlea and vestibular apparatus. I think you have completely recovered from the post-traumatic stress of the ENT classes. So ENT is anatomy. You need to crawl through the middle ear, inner ear, and that 6-chambered middle ear box to make you understand that. First of all, me to understand was a very challenging job. Now, but one exception you need to remember. Sometimes the labyrinthine, instead of arising from the basilar, it typically arises from the anterior inferior cerebellar artery, which is directly the branch of basilar only. Directly arising, it will become the granddaughter instead of being the daughter of the basilar. Daughter's daughter. Daughter is anterior inferior cerebellar. So, doc, This is the basilar artery. These are all the various pontine branches, and it is also giving rise to anterior inferior cerebellar artery, and from anterior inferior cerebellar artery we have the labyrinthine artery, which will ultimately go and supply the vestibulocochlear apparatus. So 85% of people anterior inferior cerebellar artery will be giving rise to labyrinthine artery. Then they have a superior cerebellar artery, no? That superior cerebellar artery also is a direct branch of the basilar only. So 3 sisters, 2 husbands. Because both anterior inferior cerebellar artery and superior cerebellar artery both are married to basilar only. I thought from posterior cerebral. No. Posterior inferior cerebellar artery is arising from vertebral artery. Good. Then ultimately it gives rise to posterior cerebral artery. Posterior cerebral artery mainly supplies the midbrain, temporal and occipital lobes of the cerebellum. So in the brainstem, medulla is by vertebral artery and its branches. Pons is by basilar artery. Midbrain is by mainly posterior cerebral artery. Right? So that's what we need to basically appreciate. So what is the circle of Willis made up of, doctor? It is made up of posterior cerebral, posterior communicating artery, internal carotid, anterior carotid, and anterior communicating artery between the 2 anterior cerebral arteries. Middle cerebral artery nahi hai isme. It arises from the internal carotid, but it doesn't participate in the circle of Willis. Directly internal carotid only will participate. So that's the whole idea. So doctor, that brings us to the end of the circle of Willis.